Great. This is Dr. Ward Henry. We are in the third tutorial of chiropractic treatment of sports injuries. The chiropractic treatment that we're talking about centers on use of the proprioception system and its responses and reactions to repair damage and stabilize joints so that the player is able to play. One of the things that we make our claim is the fact that we can put an ankle sprain back on the basketball floor in under 5 minutes, no matter how bad it is, unless there's a fracture. So this is one of the reasons we use it. Right now we're going to look at the shoulder. The things that we find in the shoulder most often are due to basketball or baseball. We're going to use Latika's shoulders because they're better looking than mine. All right. The first thing we're going to do is we're going to test the shoulder for Codman's motion. Codman was a doctor back in the 1500s who went through all of the shoulder parts and named all of the motions. So he has a motion that looks like this. You take your anterior hand and put it on the humeral head. Your posterior hand is going on the scapula, and you're just going to hold them like this. Your motion is going to be both of them bringing your thumbs up together, allowing the shoulder to come up and around. Okay, when we do this, see this motion? It's nice and easy and very full. That means we don't anticipate a problem with the shoulder. If you take a hold of the shoulder like this, try to reproduce Codman's motion and nothing happens, or there's a great deal of resistance to it, you've got a lot of work to do. All right. The next thing we do is we check the relative strength of the major muscles for the position of the shoulder. Put the arm out like this. This is the abductor muscles. We're going to push down. She's going to hold. And that, put it down please, that motion, that position should lock. I should be able to get up and lean on it like that for any athlete. And if you can't, then you've got some work to do. All right. Checking the flexion, we have the same thing. I'm pushing down. She's going to hold, and that shouldn't give it all either. The third motion we're going to check is external rotation. We're going to push down on the wrist. That's good. We're going to push up on the wrist for internal rotation like that. All right. So now what we've done is, let's say we've established the fact that the shoulder doesn't have all the requisite strength that we want to have when they go out to play. You're going to start with using kinesiological techniques, origin insertion of the upper deltoid. Approximate the origin and insertion tendons and get up in the middle. You don't have to do this rigorously, and it doesn't have to be done to the point of pain. If there's a problem with the muscle, it'll be sore, but you come up in the middle where and you want to palpate where the muscle spindle inserts are, and you stretch those out. Now you're going to check deltoid. Now we're coming up to supraspinatus. Supraspinatus is, of course, the muscle that sits on top of the scapular spine. Again, origin and insertion. Origin and insertion. Elongate and stretch the tendon sensors. You're going to come up, you're going to find the muscle spindle, which is right here. And again, you're stretching this out. Those two muscles should account for the strength of the abduction of the shoulder. Come up, hold strong, push, and there she is. All right. The next thing we're going to look at is the infraspinatus, which is, again, the origin is across the back of the scapula and the insertion is into the posterior part of the shoulder. Again, AK to stretch the origin and insertion tendons. Then AK to stretch the muscle spindle fibers. Okay, we're going to bring this up and stop a second till I got